Hello everyone, my name is Kayla Fritchie, and the drug topic I decided to do my infomercial on is fentanyl. So what is fentanyl? Well, fentanyl is a potent synthetic opioid drug that has been approved by the FDA for use as an analgesic, which is a pain relief medication, and as an anesthetic. Fentanyl is approximately 100 times more potent than morphine and 50 times more potent than heroin as an analgesic. How is fentanyl used? Fentanyl can be snorted, sniffed, smoked, taken orally by pill or tablet, spiked onto blotted paper, or sold alone or in combination with heroin and other substances. It is also important to note that fentanyl has been identified in fake pills mimicking pharmaceutical drugs such as oxycodone. Fentanyl has multiple effects on the body. Some of the physical effects include dizziness, nausea, vomiting, urinary retention, which means it's difficult to urinate, constricted pupils, and respiratory depression, also known as slowed breathing. Some of the mental effects include relaxation, euphoria, pain relief, sedation, confusion, and drowsiness. There are multiple risks of fentanyl use. Fentanyl is highly addictive and can be easily abused due to the small amount it takes to become lethal. For picture reference, look to the left to see just how small of a dose is considered lethal. Adverse effects of fentanyl, including overdose, may be experienced with even just a single instance of use. Also, many illicit drug dealers mix fentanyl with other substances, and it's almost impossible to see with the naked eye if other drugs have trace amounts of fentanyl in them, so it's commonly overdosed on. For people who have built up no tolerance to opioids, and even for those who have, consuming fentanyl unknowingly with other drugs can be extremely dangerous. There are also other consequences of fentanyl addiction. People addicted to fentanyl who stop using it can have severe withdrawal symptoms that begin as early as a few hours after the drug was last taken. These symptoms include muscle and bone pain, sleep problems, diarrhea and vomiting, cold flashes with goosebumps, uncontrollable leg movements, and severe cravings. This slide shows some statistics related to overdoses from fentanyl use. Overdose deaths within the United States has exceeded 100,000 in just a 12-month period for the first time. 64% of these deaths involved synthetic opioids, which was mainly illicit fentanyl. This was from May 2020 to April 2021, which is up more than 91,000 overdose deaths than from December 2019 to December 2020. As you can see in the map, most of the Northeast region continues to suffer the highest overdose deaths, but several regions of the country also showed sharp increases in fentanyl-related deaths. What to do if someone overdoses on fentanyl? First, it's important to recognize the signs of an overdose. When someone is overdosing on fentanyl, they will be unresponsive, have irregular breathing, look gray, blue, or pale for their skin color, and have very small constricted pupils. How to reverse an overdose? First, call 911 immediately. When you call 911 or someone directly nearby, you need to say that you are supporting a suspected overdose. Next, if you have naloxone ready, administer it. Naloxone is a prescription that can help stop someone's overdose. First, announce that you're going to give the naloxone and spray the naloxone in a person's nose. Then, if someone has no pulse and they're not breathing, administer CPR. Make sure that the individual's head is back and that their airway is open, and then apply chest compressions. After administering CPR, if there's no response, give naloxone again. Make sure that you remain calm and comforting until the person is revived. That is all for this presentation. Here's a list of my references that I use. Thank you all for listening.